Hey everyone, it's Maddie Mackey here. So this video is going to be about the newborn procedures that happen as soon as your baby is born and the traditional standardized things that'll happen in the hospital. So without going into too much detail of each individual thing, I just wanted to educate and give my perspective on the procedures that are listed as standardized normal procedures. And I am a little opinion based in this conversation just because I've been doing a lot of personal studying and research. But like I'm gonna say with all of these things, do your own research, do your own homework, and really listen to your intuition on what's going to be right for your baby and safe based on the birthing situation that you do have. Okay, so the first thing I want to touch on is the placenta. So as soon as baby's born, after that you'll have another contraction where the placenta comes out. This is super interesting, and a lot of people, it's becoming more and more normal and regular now, but a lot of people will normally clamp and cut the placenta pretty quickly. But the placenta contains stem cells and blood that is so important and vital for the baby's nutrition. So letting the placenta fully pulse and stay connected to the baby, and sometimes they'll even take the placenta and push the blood towards the baby, is very beneficial. And as long as you have a safe, normal, healthy birth, the ability to have those things happen is normally pretty pretty regular, and the doctors will allow it, or the midwives or doula or whoever you might be working with. So keeping the baby connected to placenta for as long as possible is definitely something I am a big fan of and would highly recommend for the number of reasons that stem cells will be important for your baby's well-being. After the placenta, after everything's birthed, mom's all good, and just starting the healing recovery process, there is the weight and length check. So that one's pretty standard. I think there's not a whole lot of risk with that. Most of the times they do it right in the room next, or in the same room next to you. So it's really nice because you don't have to be away from baby measuring the height and weight. It's just important to do so they can begin to track the measurements as time goes on and see if baby's growing or shrinking, or kind of what the normal process or abnormal process your baby might be going through in the first few weeks of life, to make sure that they are receiving all the nutrients that they need. The next thing is the Erythromycin Eye Ointment. So I am definitely not a fan of this one personally. According to my research, this eye ointment is something that has been given over a long period of time and just become one of those standardized things that they just kind of give because it's available. Really the only reason that they would be giving this ointment is if the mother had an STD, specifically like gonorrhea, and the baby was birthed through the vaginal canal where the STD would be present, and it would get to the baby's eye, and the baby would then become blind. This ointment also burns the baby's eye, so it's something that we're giving to babies when the mother doesn't have any gonorrhea. Lately with pregnancy, they're so important with, they're really like up to date with doing STD checks and making sure everything's safe and healthy. And if things appear to not be that way, they'll likely do a C-section and an alternative form of birth just to help avoid that kind of contact with the infant baby. So the erythromycin eye ointment is not something that I believe in, but again, do your homework, do your research, and see what works best for your birth and your situation. The next thing is the vitamin K injection. Another one that I'm not a big fan of. I know I'm not a big fan of a lot of these, and I'm definitely not like an anti-vaxxer or anything like that. I just do a lot of research and pay a lot of attention to these things. This is, I don't know if we'd even call this a vaccination, but it's an injection of vitamin K. No baby ever, no human ever, is born with vitamin K in their system. So what vitamin K does is it helps with blood clots. So the only reason and the circumstance that I would be open to a vitamin K injection would be if baby had some trauma during birth where there was bruising or risk of internal bleeding or external bleeding, of course, if that was obvious. In that case, the vitamin K is really effective with helping the baby begin to clot and protect themselves from any bleeding. There is an alternative to the vitamin K injection, so you don't have to give baby a needle immediately upon birth. and it is a oral supplement, and that is given over the first few weeks of life. It's pretty consistent, so you have to definitely like set alarms and keep up with it. Just a little dropper in their mouth, and that starts to stabilize the vitamin K in smaller doses in babies' immune system and in their body. So that's definitely the route that I would take. Do your research again, do your homework, and of course, if a doctor, a medical emergency is happening and a doctor or midwife is recommending something, be open to change as well, because obviously we want to keep babies safe and healthy, and sometimes vitamin K might be what someone needs. It just depends on the circumstance. Okay, next thing is hepatitis B vaccine. This one, I'm sure you can guess, we are kind of on the no train here. I'm also against. So hepatitis B is transferred from either needles or bodily fluids, whether it's semen, vaginal fluids, vaginal secretions, or saliva. So hepatitis B is not a risk for your baby unless mom or potentially dad, or someone who's going to be in that space has already contracted hepatitis B. Your baby's not likely going to be around any contaminated needles, or any needles for that matter, or having mix of vaginal fluids or semen or anything. So, take that into consideration when you're making the choice to begin with a vaccine at like the first few hours of a baby's life. Also, the only reason that they're really giving the Hep B vaccine is because if you're birthing in a hospital, you might be exposed to Hep B, as in someone within the hospital prior, present, or in the future might have had or has Hep B. So they're doing it as a standardized method to just be cautious, which is great. Cautious is great, but flooding your baby with that much aluminum is not great. From the research I've done, I think it said it's like 250 milligrams of aluminum, which is about 16 times the dose that a 7-pound baby it could definitely stabilize in a healthy way. And babies, until they're toddlers, the blood-to-brain barrier is not completely stable either. So it's definitely something to keep in consideration if you want to flood your baby with that much aluminum at that time before the blood-brain barrier is completely developed. And if you times 7 times 16, that's like over 100 pounds is what you would need to be, about 112 or 15 pounds that you would need to be to sustain and process the toxicity of the amount of aluminum and heavy metals that would come with that vaccine. So I know there's a lot of controversy around vaccines. There's definitely a lot of controversy around the newborn procedures. This is just my personal take, my belief system, and my research, and just wanted to share it, give some education out there for anyone who is doing their own research and doing their own homework. I have been talking to my doula. I've also been reading the Vaccine Friendly Plan by MD Paul Thomas and PhD Jennifer Margulis. This book's been very helpful. And there's a couple other resources that I've been using that are definitely scholarly resources. I look up holistic resources as well, but I like to keep it scholarly and evidence-based, of course. The last thing is, if you're in California, there's the California Newborn Screening Test, which is a little prick on the baby's heel, where they take some blood and they test for a large number of things. And this one is something that I am open to. So they test for hypothyroidism. I'm not going to name everything, you can look it up. But this is a nice test because it's going to help with things that might come up in the first few weeks of baby's life, with how they're digesting, how they're taking the milk in, how they're going to the bathroom, all these kind of things that might get confusing. This might answer some of those questions in advance. And it's a small prick. Obviously, it's not comfortable for a baby, but out of all the pricks, this is the one that I would definitely say yes to. So that is all of my information. Again, my name is Maddie Mackey at riseaboveyoga.com. And if you want to find me on Instagram, I am at MaddieMM, MaddieMM. And thank you so much for checking in and watching this video. Good luck to all you mamas out there.